What is rehab or rehabilitation? My name is Fred Bagares, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. As a new business owner trying to create a new healthcare model, I had to think about what is my ideal, patient. And conversely, I had to also think about who is not my ideal patient because my practice is new and I am largely the minority. I definitely understand that I'm going to attract a certain type of person, and probably a lot of people will automatically be turned away. Nevertheless, I do think I can help everybody, but maybe my practice isn't for everybody. So I wanted to do this particular talk on who would not like my practice, and I broke it down into a couple different features that I've noticed over the past year. The first one is if you don't like having a personal relationship with a physician. My practice is more of a mom and pop type feel versus like a big box feel. So I'm not a big chain where you call and you get an automation. You have to click on a bunch of links. You talk to the receptionist. You come in, you talk to the MA. I'm pretty much beginning to end. You call my phone number, you get me. I room you. I do all the procedures. I do everything. Any follow-up questions goes directly through me. So if you don't necessarily like that in particular, or maybe you don't like me, maybe I might not be the right practice. But all joking aside, I do provide a fairly mom and pop feel, and I'm very a big reason I started this practice was to get to know my patients better. But it may not be for everybody. Some people kind of like to have, less of a personal feel. And again, maybe my practice might not be the best fit. The next the next feature of my practice that may turn you off is if you do not like to use technology. So my practice is very much online. My registration I do electronically. Payment is done electronically. Charts are done electronically. Usually, there's not a lot for my patients to do except for register and also email and text. But some people they don't really like that. I'm fairly accessible, and it allows me to provide a higher level of care using technology, and it also provides me the opportunity to be very efficient with your dollars and time. So it is a big part of my practice. I have had some patients, ask for paper version, which is fine. But again, my practice is really trying to be innovative, and using and leveraging technology is always going to be a core tenet of my practice. With respect to patient kind of personality or avatars, I'll call them like an avatar or a phenotype. There are some patients that are looking for the quote unquote quick fix, whether or not that's just an injection. Perhaps they want only surgery. They're not interested in conservative management. And my visits are typically 60 to 70 minutes. And that allows enough time to not only talk about quote unquote quick fix, but the overall game plan. Because in my mind, injections and surgeries help with a certain part of the rehabilitation program or journey. Just because the pain is gone doesn't necessarily mean that you're done rehabilitating. I've noticed that over the years, people can sometimes fall into that pattern where they seek treatment, that makes the pain go away and they go back to what they were doing before. And that often leads them back into the clinic, receiving the same injection, or sometimes proceeding with a surgery and then going back to doing what they like to do without changing anything, and then they end up in the same situation. So I'm happy to talk about the quick fixes, but I'm also more interested in talking about the overall game plan. Again, not all personalities like to talk about all of that. If you are interested only in, let's say, like a surgical solution, I think that's fine. That's your prerogative, and I'm happy to support that. So I have seen people in my practice come through, and I've identified that that's their goal. So I am able to help facilitate that in terms of getting the necessary imaging, doing the appropriate conservative workup, and quickly getting them to a surgeon. That is 100% fine. I'm happy to do that. That being said, because my practice is cash based, a one time visit may be beneficial in that situation. But again, if you are in that quick fix mindset and not changing anything, my practice long term may not be the best practice because it just won't be very cost effective for you. The next patient personality or avatar is someone that assumes that there is only one main problem. And the term root cause is very catchy these days. I do believe in the root cause, but I think it also assumes that there is only one thing wrong. And sometimes that's the case, meaning that the root cause of my thigh pain is that I broke my femur. Like that to me is kind of a fairly simple, one-to-one connection. That is the root cause. However, when someone walks in with hip pain and they're walking differently, sometimes the cause of the problem is a single problem, but oftentimes there are secondary problems that have sprouted from the primary problem. And of course, it makes sense to treat the main problem and the secondary issues go away. A great example of this is hip spine syndrome, where people will have kind of a constellation of hip pain, back pain, and radicular symptoms, and they kind of bounce back and forth. Hip spine syndrome is not a single root cause problem. There are several different issues. Obviously, people come to me in pain, and their main goal is to make the pain go away. And I can certainly help with that with medications, injections, and I can get to the root cause by doing imaging, ultrasound, things like that. But even if I identify the primary root cause or the single main problem, again, there are typically multiple different things going on at the same time. I like to address that in terms of everything. Some physicians are a lot more focused, where they only treat hip, they only treat back, they don't do surgery, they only offer injections for spine related disorders. Again, that sometimes fits people's picture. I think it's a little bit harder to convince someone that has leg pain coming from their back and trying to convince them that it's actually starting from their hip from a physician standpoint. I think from a chiropractor, physical therapist, maybe any other medical provider, it's a little bit easier to talk to patients about that, because I think they have a lot more time. Again, that is the reason why I created my practice, is to create more time to talk about all these problems. But again, some people don't want to talk about everything. They just want to look at, I only have one problem, make the pain go away. If I take care of the main problem, everything goes away. That's my belief. I don't really combat that too much, because I've found that if you are the type of person that believes that there is only one problem, and if you solve that one problem, everything else will go away, you're not going to debate you on that, because I've found that that doesn't necessarily get me or you anywhere. I do listen to your concerns and how you construct your belief of how the problem it was constructed. But again, I want to talk about everything. So the next avatar is someone who does not like to make lifestyle changes. Lifestyle changes meaning work, sleep, formulating an exercise routine. Lifestyle changes are probably the most proactive thing that anybody can do at any point in time to improve their health, decrease pain, and also improve mobility. But naturally, it is the hardest. So people tend to like to focus on the easier problems or again that quote unquote quick fix. A lot of my patients we will have deeper discussions on work. Is a good example. Some people have very physical jobs and they have musculoskeletal problems. That's okay when you're in your 20s, but I like to talk about, well, what is your overall goal in life? Like, what does your work life trajectory look like? And does that match how your body is responding to your current rehabilitation program? Because it is tough for me to see a very common story where someone has a very physical job and they're into their, late 50s, early 60s, and they're just trying to make it to 65 and they're really, really struggling. Not to say that, that's the wrong thing, but if there was any, thought of transitioning into a less physical, maybe an administrative role or, maybe changing jobs at some point, what does that look like? Again, that's a very, very tough question, to have in a 7 minute, typical visit. That's why in my practice, I like to have more time, bigger discussions. And again, it may not be something that people like to talk about. Even something as simple as like an exercise program. I like to talk about that in detail. I encourage people to not just exercise to get their heart rate up, but in order to just create ways to make it part of your day. I find that that makes people stay out of the clinic for longer periods of time, and that to me is ultimately the goal. Again, if that's not something you like to do, I might not be the best clinic for you. The last patient avatar that may not like my practice is folks that don't like to be held accountable. And I'm just as human as everybody else. Being held accountable is very tough. And my job is not necessarily to make the hard part easier, it is to make the hard part scalable. So, life gets in the way, we can't see a pathway forward. So I try to create ways to create essentially a life game plan, movement game plan, work game plan, everything. So again, that's where my longer appointments come into play to have these deeper discussions. Getting back to the technology, I send follow-up texts, follow-up messages to make sure that you went on the vacation that you wanted to, or that you kept running, or are you still doing what you're supposed to do? Again, some people don't like that. So, but that is my general style. I genuinely want to know not only how you're doing, but also is my method working? And I believe that that's one of the big problems in the current healthcare system and in medicine is that there's just really people don't follow people long enough to actually know if they're doing good. I think we just assume that as long as people don't come back, that they must be better, and that's just not the case. Again, I believe I can help everybody, but my practice may not be for everyone. So I thought that this was kind of an interesting topic, different way to talk about my practice, but also to help other people who are looking into seeing me understand my style. Thanks again for your time. Take care. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.